Hearing loss can affect a child's ability to develop communication, language, and social skills. The earlier children with hearing loss start getting services, the more likely they are to reach their full potential. The audiology specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explain how hearing loss in youth often presents.
For children to have hearing loss, the earlier we find out, the better it is, because it's a part of them. And it's not something new that they have to get used to. It's not something that all of a sudden they're made fun of. When we find a child that's in their early teens that has hearing loss, then they feel a little devastated. They're embarrassed. Something's wrong with them. They don't want people to know they have hearing aids, and a lot of times they will not wear them. And so we have to look at other means of trying to help them in the classroom, and we work with the school systems on educating them as to how they should amplify the classrooms for that child to do better. We test children of any age, and most of them pass their hearing screenings with no problems. If a child has hearing loss, then it could be a temporary condition that can be corrected through surgical procedures. Maybe they need to have tubes placed in their ears, and that usually can correct that, and then they're hearing fine and everything is going to work well for them when they go to school. For children who have more of a permanent hearing loss due to birth or some other illness that they may have had, then we will start talking to the parents about how we want to rehabilitate that by use of hearing aids. Most of the time when a child has hearing loss that's associated with ear infections, it can be easily corrected. Occasionally there might be some scar tissue from years and years of infection that goes untreated and really neglected, and then we can see a mild hearing loss that again can easily overcome through amplification.
The CDC suggests these screening guidelines for parents and guardians. All babies should be screened for hearing loss no later than 1 month of age. It is best if they have their screening before leaving the hospital after birth. If a baby does not pass a hearing screening, it is very important to get a full hearing test as soon as possible, but no later than 3 months of age. If you think an older child might have hearing loss, ask the doctor for a hearing screening as soon as possible. Children who are at risk for acquired, progressive, or delayed onset hearing loss should have at least one hearing test by 2 to 2.5 years of age. Hearing loss that gets worse over time is known as acquired or progressive hearing loss. Hearing loss that develops after the baby is born is called delayed onset hearing loss. If a child does not pass a hearing screening, it is very important to get a full hearing test as soon as possible. You can find more information on the hearing and audiology services available at Lake, Ear, Nose, Throat, and Facial Plastic Surgery when you click on the Pediatric Hearing StoryLink icon on our homepage, yourhometownhealth.com.